speaking directly to employers, health plans, as it pertains to genetics, genomics, and technology. What are the three tips that you would give them that they need to pay attention to that might be emerging, or things that are already out there that they may not be aware of, that not taking advantage of?
First tip that I would say, and the first question that you should ask is, how can I work with my employer? How can I, as the employer, look at my data and figure out how much of the money I spent was a waste? Employers are good at thinking about waste because they know to the cent what they pay for all their gadgets and widgets, and they know to a cent what they pay for W-2s, right? So why are they writing a blank check for the number two most expensive thing that they manage? And then the second thing that I always say to them is, do not believe, do not assume that what your traditional insurance company or carrier covers is the full extent to what science has proven or what healthcare believes to be correct. There's a very linear assumption that employers make, which is that if my carrier covers it, it's good. And if my carrier doesn't cover it, it's unproven. And that doesn't have a lot to do with what is scientifically proven, what is innovative and proven, what is going to decrease the total cost of care. We just need to know what we're dealing with. And when we know what we're dealing with, we can create solutions instead of all of this non-productive figure pointing. Things are the way that they are, right? But employers can make different decisions when they think about things that way. And we have found that to be a very productive way of working with our employer clients and working with brokers, and of really starting to introduce innovative precision programs and strategies that, are totally proven. It's just that, well, the carrier never covered them because they were operating off of a different set of what was important.